Hi there, Jennifer Bell here. Today I wanted to talk with you about Medicare and HSA health plans from your employer group health plan. That's a mouthful. If you have an employer group health plan with a high deductible, you most likely also have an HSA account that you can contribute to. So let's say you have been contributing to this HSA over the years, and then you decide at 69 that you're wanting to retire. About time, right? So what you want to do is have some advanced planning going on. What I mean by that is if you are on an HSA plan and Medicare at the same time, you will be penalized by taxes. And I have to be honest with you, I'm not quite sure what the percentage is on taxes. I just know that they're going to penalize you somehow by contributing to an HSA while on Medicare. So in that same breath, let's say you turn 65 and you're on a high deductible health plan with your employer and you're contributing to an HSA. If you choose to enroll in Medicare Part A only, you will need to stop contributions to your HSA. So it's something that you want to keep in mind. Another thing is when you delay enrollment in Medicare, that's fine. If you're on an employer group health plan that serves as creditable coverage, you don't have to worry about going on Medicare right when you turn 65. So a lot of people will just delay the whole process altogether because it's just one less thing to do, right? No problem. So if you delay it altogether, what you want to know is that Medicare will backdate Part A up to 6 months when you enroll late. The reason they do that, I have no idea. It's just because they can. Part A doesn't cost anything to you, so it's free additional coverage. I'm guessing that's how they're looking at it. And then Part B, they'll start when you request for it to start. So let's say that you're 68 and you're going to retire from your employer. Now, if you're on an employer group health plan and it's a high deductible health plan and you're contributing to an HSA, 6 months before you retire, you're going to want to stop contributions to that HSA. As long as you do that, then when Medicare backdates, and they backdate those 6 months, as long as there's no overlap, there's going to be no tax implication. Awesome. So that's what you're going to want to plan for. Also, if you're going to retire at 65 and you've been contributing to an HSA, you should be fine because your Medicare will start the first of your birth month. So kind of keep that in mind. Unless your birthday falls on the first of the month, then they actually start Medicare the month prior to your birth month. So you'll be 64 and 11 months old, But just kind of keep those things in mind. So when you are contributing to an HSA, you have the planning going on. You know that you can stop contributions to your HSA mid-year. Most employee benefits providers aren't gonna say, no, you can't do it. You can only do it during open enrollment. You should be able to stop contributions mid-year as well. So talk with your employer, make sure that you have all the timelines worked out correctly so that you don't get any sort of tax penalties. And if you have any questions, because this can get really crazy and super confusing, please reach out. Don't hesitate to shoot me an email. You can call me. I'll hash out your situation with you and help you through every step of the way, because sometimes we just have little questions here and there we need answered, and I'm happy to help you. And if you have any friends or anybody that you think would benefit from this, please subscribe to the channel and share it with your friends. I'm happy to help them as well. All right, hope you have a great day, and I look forward to seeing you on the next video.